Now with our GMA cover story and 40 years of pink. That's 40 years of October being Breast Cancer Awareness Month, and early detection is key. But if you're one of so many women with dense breasts, detection can be more difficult. So joining us now with guidance is Dr. Elizabeth Comen, a breast medical oncologist from NYU Langone. Thank you so much for being here. Let's start with defining dense breasts.
So first of all, dense breasts are really common. About 40 to 50% of all women have dense breasts. And it's not something that you can see or feel. It's something the radiologist will tell you. And really what it refers to is really just the ratio between how much fibrous breast tissue you have versus fat on a mammogram. And the issue is that fat will appear black on a mammogram, and cancer and breast tissue can also appear white. So when you're looking for a cancer, it's like finding a snowflake in a snowstorm.
Wow, that's a really great way to put it. So how is technology catching up to help with early detection for women with dense breasts?
So that's a great question. So all women now are required to be informed on their mammogram if they have dense breasts. If you have dense breasts, you really need to talk to your doctor about whether you need additional imaging, such as a breast ultrasound or breast MRI, to detect an early cancer. And we have some newer technologies that are under investigation, like artificial intelligence, contrast-enhanced mammograms. And there's lots of new hope that we can detect cancers even earlier now.
Okay, so let's say a woman goes in for a mammogram. She is now notified, because she has to be, that she has dense breasts. There are further options, as you said, for either an ultrasound or an MRI.
Yes.
You need to talk to your doctor about that, though, because it's not necessarily going to automatically be recommended, right?
I wish it were, but it really puts women in the position of having to advocate for themselves.
Yeah.
Make sure you talk to your doctor about whether you need additional screening, but also what age you should start screening. So most women of average risk should start screening at age 40. But if you have a family history or other personal risk factors, you may need to start earlier than age 40 with your screening.
Okay, and that can be challenging, of course, because insurance may not cover it, all of these things. But just for women out there listening to know, you have to be your own advocate.
Yes.
You have to push for these things, ask more questions, whether additional testing is needed. Turning now to breast cancer and medical disinformation, you're hearing from patients skeptical of traditional science-backed treatments. Why do you think that that's happening?
Oh, there are so many reasons. If we look at the landscape of healthcare today, it's understandable why a lot of patients have distrust in science and our healthcare system. And we need to work, we as doctors in our healthcare system, to rebuild that trust. But there's an awful problem out there, and that is the misinformation that's on social media. I see every day how women are being sold a false bill of goods on social media about magic bullets and things that are going to, miraculously cure them. All cancers for that reason.
Yeah.
And it's really terrifying and it's heartbreaking, because we often will miss a window to cure a woman of breast cancer or other types of cancers because they've been sold this false information.
And this is why early detection is so key, right? Even if you're afraid.
Yes. Early detection, but also investing in the science and research that will actually improve the landscape of women's healthcare.
Okay, so much of this is so important, and we have to keep it in mind. So great that you're here to talk to us about it.
Thank you for having me.
Thank you for being with us.